Sir, like I have hairloss from 2020.
Yeah.
I'm suffering from it till now.
Uh-huh.
And in previous, like in 2020 also, I went to a dermatologist, and there I saw him about like what's my condition. But at that time, I feel like I am just losing thick hairs. I don't have any recession or things like that. So he gave me finasteride and minoxidil, and he said that you can use it for next 6 months or something, and we can stop it. So he didn't tell me about what are the consequences of it, like what is the shedding phase and all this. So I took it for 2 months. So up to that point, I have I feel a little improvement in my hairs because my shedding stopped. But again, as we know that these medicines will cause shedding, so that started at that time, and due to the panic, I left those medicines. Then my hair, I feel that my hair loss stabilizes for few months, and again it came back. So I don't remember the exact date, but I started finasteride in September. But at that time, I feel that again the shedding started as the usual process. But at the time, I feel that I am facing some side effect from that. So I stopped it after after talking with my dermatologist. I stopped it for 1 month, and then again I started it with a low dose of 0.5 every other day. I'll do I have done it for 1 month, and then I'll take from that day to now I'll take 0.5 every day.
You're taking 0.5 milligram finasteride every day. Now you're taking
Yes.
0.5 milligram every day since how many days now? Non-stop.
It's been 8 months.
8 months. Yeah. So you have not been taking any breaks in between. You've been taking it regularly without stopping since past 8 months, since November.
Yes.
Is it? And
Yes.
so now,
Yes.
what are the problems that you are facing?
So right now, up to this point, I feel like that I did not see any improvement in my hairs. I feel like that I'm continuously like the recession is continuously going on. But from the past 15 days, I feel like the shedding is stopped right now. I saw very few hairs in showering, like 1 to 2 hairs, something like that. And I also am seeing a little piece fuzz of my hairs, like around the hairline, a little hair, baby hairs. So I don't understand that this is going on, like will go on so much, like for the 7 months or 8 months. So or do I need to add something more in my stack or something like that?
What are the you said you are having some problems. What problems are you facing? Any side effect of finasteride you are facing?
At that time, as I talked in September, I feel like that I face some side effect of maybe the gynecomastia, but it can be some nocebo effect. Exactly, I don't feel it. So at that time, I stopped it for 1 month. I did it with little dose, and I increased that dose after 1 month.
So
My concern,
have you got your blood tests done before starting finasteride?
yes, sir.
So what was your level, testosterone level before starting finasteride?
Okay. And then, wait. So my testosterone level it's 540 mg per ml.
That's fine. That's perfectly
5.4
fine.
So, yes, sir, 5.4 mg per ml.
And estradiol level?
And these are 27.83 pg.
Perfectly fine, within normal range. So you don't have to worry.
Yes.
See why you think the drug is not acting. Firstly, you're 21 years old. The drug is acting,
Yes.
but probably it cannot control the baldness, because your baldness at 21 is very severe. So probably that is one reason. But a lot of hair, you still have a lot of hair. You're worrying unnecessarily. The hairline is maintained. Little bit of recession is nothing much. Actually, that can be normal also. But if you think that it's progressing fast, it could be due to several reasons. One is that despite finasteride, you are having it because finasteride does not block all your DHT. It blocks only about 67%. 23% is still active. So because of that, it will continue to go on. Secondly, it could be because your dosage is less. You're taking half a milligram on every day. You could start taking 1 milligram every day and see some change. Okay. Third reason could be that you're taking it for a long duration without taking a break, and your body is getting used to it.
Okay.
So remember that now after first 6 months, you should take a break of 2 weeks every 3 months. Take it cyclically, switch on and switch off technique. Firstly, it'll help in avoiding tolerance to the drug, and secondly, it will also give you an indication that if there's no hair loss, excessive hair loss during that period of 2 weeks, it will give you an indication whether you can go off the medication also or not. If you're taking it continuously, you will not know whether the baldness is stabilizing and you can go off the drugs. Okay?
Yeah.
So I will suggest that you take a break of about 2 weeks, continue for 3 months, and then see whether it is having an effect. If it's still not having an effect, then we will have to increase the dosage to 1 milligram every day.
So do I need to add any growth
Nothing.
stimulant right now?
Nothing, yes. You take a break for 2 weeks, and after 3 months to 4 months, we will see after 4.5 months what to do. Till then, this is good enough. Are you taking minoxidil as well?
Like right now, I haven't started it.
So you can.
Like
You are otherwise in good health. No medical problem.
No, I don't have any medical
Okay.
problem.
So you can start taking tablet minoxidil 2.5 milligram at night.
Okay.
Okay.
And sir, is there anything that I can follow in my diet and all?
Yeah, diet. You are vegetarian or non-vegetarian?
Vegetarian.
Vegetarian. So you can increase the amount of soya, increase the amount of egg, paneer in your diet, but do not take supplements like whey protein, creatine. Okay.
No, I am not using any of that.
So
Is it like, can I go to gym during this process?
Yeah, you can go to the gym, but do not do too many anaerobic exercises. Anaerobic exercises would be any exercise which makes you go out of breath for a sustained period of time, say about half an hour, that you are panting for breath for half an hour. So that is not good for your hair when you have the baldness gene, because it further sensitizes your follicles to DHT. It spikes the DHT levels also. So do exercise every day. You are most welcome, but do it in moderation.
Okay, so like I don't have to exceed the 30-minute window.
Yeah, of severe exercises, anaerobic exercises. Anaerobic exercises are those in which your body goes into a condition which is without oxygen. You're panting for breath for a sustained period of time.
So also, sir, I want to know one more thing. Do I need any multivitamin?
No.
Basically, then
This is not because of vitamin deficiency. This is pattern baldness, and it is not too severe in your case. So you don't have to worry too much. The only problem is you can't go for hair transplant because you're only 21 years old. You'll have to wait for another 3 to 4 years before we can do your hairline.
Yeah, like I have seen some, like from the past 2 days, I am seeing some little fuzz around my hairline, and I feel like if my shedding stopped, then this is
That's a good thing.
Regrowth.
So that's a very good thing. But first, take a break of 2 weeks and then continue. Okay.
And sir, one more doubt is: do I need to use any like the derma roller?
No, nothing else. Don't use anything else that can add to your hair loss, because all these things are not good for the hair which are going away. That is the hair which are going to be shed out. They'll shed out faster. It will decrease the hair count on your head when you have a lot of thinning. Okay? Not for your case. Your hair condition is not so bad.
Yeah, but I feel that the density is very low.
Yeah, I see. What your density was in adolescence when you were 18 will not be the density that you will have at 21. The density you will have at 25 will not be the same as at 21. And similarly, when you become 35, you will remember your hair of 25 years of age. It's all like that. The thing in this body is permanent. You will, as you advance in age, your hair will continue to become less voluminous.
And any more suggestion that you would like to give?
Yeah, nothing else. Just follow good lifestyle habits. Sleep in time, get up in time, sleep with the sun. Don't keep unnatural hours of sleep. Okay? Decrease the stress, like plan the day ahead. Don't get into stressful situations like that without planning. And rest, I've told you about diet, and I've told you about exercise. I've told you about sleep cycle. That's all, nothing else. If you have still any questions, you can leave a voice message, and I'll reply back to you. Okay?
Okay, sir.
Okay then.
Thank you so much.
Okay, bye-bye. Bye.
Thank you.
Bye.